Hello, everybody. Welcome back to Macros and Micros. I am Dr. Emery Pitcel, Rothrock Chiropractic and Rehabilitation.
And I'm Dr. Maggie Sopic of Recenter Chiropractic Wellness and Functional Medicine.
Yeah, we want to thank you for joining us here, April of 2025. This is already our third episode, which
Yeah.
is kind of wild.
Yeah.
Three straight months of doing this. I guess we're consistent now at this point,
Yes.
right?
Love it.
We felt that it was time we did vitamin D for our first topic and protein. So if you haven't seen those, go back and check them out. But we decided we'd go into part of the B complex and we hemmed and hawed whether we should do the whole B complex, but we felt like there was enough valuable information on each individual one to break down and talk about each. So we might as well go in numeric order and talk about vitamin B1, right?
Mm-hmm. Yeah. We'll talk about it.
Yeah, absolutely. So let's jump in with a quick biochemistry. This is by no means comprehensive. If you really want to go super deep in the well, definitely do some sort of biochem course at like Penn State or somewhere else, right? They'll cover this way more in depth. But I think what's going to be nice is about the biochem that I'll talk about here. It's going to probably tie in very nicely to what Dr. Maggie is going to talk about next with function in the body there. So thiamine is better known as B1. As we mentioned, it's part of the B complex vitamins, and it is a water-soluble vitamin. Now, as a quick review, there's our fat-soluble vitamins, which means that they take longer to kind of get their levels bumped up in the body, and they do kind of get stored in fat, and they are digested and absorbed better into the body when consumed with fats. Versus water soluble, you could pretty much take it with any meal, any point of the day, have fluids, and it's going to get absorbed fairly well. More or less correct, Dr. Maggie?
Yeah.
All right. Just kind of a couple highlights here is that thiamine is a coenzyme in a lot of pathways in the body.
Yeah.
It's actually wild if you just start to like research and look up a little bit how many different metabolic processes it's tied into. So again, by no means is this comprehensive, but let's highlight a few. As far as the energy currency of your body is what we call ATP. So that's pretty much where you get all your energy to like move your muscles, keep pumping your heart, fire your nerves, right? And thiamine is a coenzyme in a lot of steps in glycolysis, and it links glycolysis to the citric acid cycle. So just really important for making energy in the body. The active form in the body is known as thiamine pyrophosphate, and that is critical for all three major types of food sources, digestion and metabolism for carbohydrates, lipids or fats, and amino acids, which are proteins, right? And additionally to it's really important for metabolism of our branch chain amino acids. It's part of the enzyme complex that helps to metabolize that. And the last to kind of highlight is a lot of us have heard of DNA and RNA. That is our genetic makeup and makes us express our genes to make us who we are and how we behave, right?
Yeah.
And it is very important as an enzyme for making something that's called ribose 5-phosphate, which is really a precursor to all of our nucleotides. So that was relatively brief, but hopefully just even in that quick 2 minutes, you realize this thiamine guy is really involved as cofactor, coenzyme, and building block on so many processes in the body. So when we get deeper into the conversation, you'll see and you'll realize like if we are deficient in it, it creates a lot of problems.
Right.
But we'll save that thought for a second here, right?
Yeah.
Anything you'd like to add to the biochemistry there?
Yeah, and I guess as you're talking about, the biochem is a lot of the function in the body though too.
Exactly.
For energy production and also that like another thing I guess like a function and also the biochem is the B1 is heavily involved in the pathways for vitamin K, like recycling and folic acid recycling. So I feel like if anyone that took any biology, biochem, chemistry, probably getting PTSD thinking of all those pathways you drew out like a million times. So like as I was like even refreshing my like knowledge on thiamine, I was like, oh my gosh. But yeah.
Right.
Yeah, those are the main things that I would, vitamin K and folic acid pathways.
Yeah, I gotcha. So you think like the biochemistry, it covered the function in the body pretty well
I was
as well,
gonna
too?
say most of the things that you discussed are mainly as far as like energy production and really helpful with how we break down carbs and utilize them as energy.
Yeah.
Yeah.
Yeah, yeah, and then it'll tie into the discussion with deficiencies, but I think what
Yeah.
you and I kept seeing in a lot of the pathways and probably a lot of the bigger, broader function, if you care to carry the ball with this for a
Mm-hmm.
minute, is it's really critical for the health and function of our nervous system,
Yeah.
right?
Yeah.
Yeah, so care to elaborate a bit more
Yeah,
on that?
more so like neurotransmitters. I mean, we do need that energy source of, we'll utilize carbohydrates in this aspect, but we need that fuel and B1 to break those down and to make sure our neurotransmitters are being produced efficiently and being broken down efficiently too, and metabolized and detoxed, we'll say too, with
Yeah.
neurotransmitters. Um, with that though, it is a coenzyme for cholesterol as well. And we
Mm.
know cholesterol is the precursor for everything at this point, like
Yes.
hormones, neurotransmitters. So we need thiamine for that function as well.
Absolutely, yeah. And then also important too for heart function, right?
Yeah. Yeah.
Yeah,
Which, yeah,
so
we'll tie in with the, yeah, deficiencies.
yeah, heart function, and then like we kind of said at the onset there, with there being the part of like the enzyme process for making nucleotides, you need to
Mm-hmm.
have thiamine, therefore, for proper cell growth and for reproduction of cell. And then I think this was what you were just kind of talking about, like not only just the neurotransmitters too, but there's ample evidence that shows that thiamine is tied into the process for proper myelination, which is the fatty sheath on a nerve as well too.
Mm-hmm.
And thiamine triphosphate is actually thought to be a big part of cell membrane excitability, which is what kicks off the whole action potential to make a nerve fire in the first place.
Yeah.
So, um, again, this little guy,
Yeah.
he's tied in a lot of different
Yeah.
places, or she, whatever you want to call your thiamine, right?
Yeah. Yeah.
Yeah, yeah.
Yeah.
Well, then we kind of talked about the function, so
Yeah.
let's get into the lamentable portion of things, which
Mm-hmm.
is when we're dealing with the deficiency. What are we going to see? Maybe kind of break down, if you don't mind, Dr. Maggie,
Yeah.
like what the less severe would be,
Right.
and then what would be the rather severe conditions that
Yeah.
doctors and healthcare providers would end up being aware, or needing to be aware of,
Yeah.
right?
Yeah. The more we'll say like lesser or mild symptoms with a B1 deficiency is there may be a like low or a carb intolerance where it's like if you have a lot of carbs, you may not feel the best.
Hmm. Hmm.
I mean, we could go on a whole podcast about that, but
Right.
or you just may feel better on a low carb diet in general. We may also recognize low neurotransmitters where we're not having that great dopamine response, or low serotonin, or
Hmm.
we're having like slow cognition where it may kind of feel like almost like a brain fog.
Yeah. Yeah.
Um, so that's more, and again, folate and vitamin K deficiency symptoms, which maybe we'll get into like another time, but because we mentioned that integration of B1 and folate and vitamin K, so we
Yeah.
could notice some of those deficiencies too. Um, I did want to talk about the causes of deficiencies.
Yeah, please do.
I mean, a simple cause, I guess, is a lack of dietary intake.
Hmm.
Um, not super common, I will say, but
Especially
then,
not in the U.S., if I
yeah,
may interject.
yep,
Yeah, yeah,
yep,
not in the U.S. We have pretty good. A lot of Americans have pretty good variability on their diets, like getting their food from a lot of different sources between plant, grains, and from meats.
hmm,
And not to mention, too, you can maybe elaborate a little bit on this
yeah,
as well, too. But a lot of our like cereals are
yeah,
fortified with a
yep,
lot of the B vitamins.
yep,
So this is something that our FDA very selectively generations ago said, no, we're going to get rid of these problems and we're going to fortify this
yeah.
in food so that way we don't have problems with the more severe things that we'll cover in a minute.
Yeah, yeah,
Yeah.
exactly. And that's with when we discuss like where to get it and how much,
Hmm.
we have a lot of enriched grains and fortified foods. So yeah, so it's not super common. But the other thing too is there are various medical conditions and of course like medications that can
Hmm.
lower the absorption of vitamin B1, and they can also increase the excretion of vitamin B1. So HIV, AIDS, diabetes, and alcohol dependence can, one, lower the absorption and also increase the excretion of thiamine.
Hmm.
Um, uh, uh, People that have had bariatric surgery are also at a high risk for thiamine deficiency.
Oh, no kidding.
Um,
Okay.
Toxic mold exposure, that's a whole other topic too, but high risk of thiamine deficiency. And again, yeah, various medications can lower the absorption of thiamine.
Yeah, yeah. I'm glad you mentioned alcoholic dependency. The only other ones to kind of cross
Yeah.
reference against to just add a little bit more to that list is Crohn's disease or
Hmm.
like so malabsorption with something like that.
Yeah.
It's one that just want to keep an eye on it as well too.
Yeah.
We have somebody that we're suspecting of struggling with anorexia. Then this might need to be a little bit of a conversation too. And then somebody on kidney dialysis.
Yep.
So again, really similar to other conditions that you just mentioned and diseases you mentioned,
Yeah.
in that there are just it's not even just going to be thiamine at that point. There's going to be a
Right.
bunch of other
Yeah.
nutrients that are going to
Right.
have malabsorption problems. But these are the ones where we need to at least have our flags up and think like thiamine could be part of the story and part of the problem, right?
Yeah. Yeah.
Um, but yeah, like you kind of said, like carb intolerance. I think other less severe symptoms is we could start to see like the peripheral nerves are going to kind of get impacted first if we don't have enough thiamine.
Hmm.
So we could start to get like a peripheral neuropathy type presentation, which that would really kind of be like numbness and tingling and burning and muscle
Yeah.
weakness. Fortunately for us as chiropractors, I would say most times if we're getting those symptoms, it's actually more likely that it's going to be a pinched nerve.
Right.
So, as the old adage goes, if you hear hoof prints, we're going to think horses, not zebras. So, I think we're going to do well if you and I treat with like our
Hmm.
exercise, our manual therapies, and our adjustments. But then, if those don't get better, then that's at least
Right.
again something that we think back on. There's going to more likely than not, if we're seeing like those numbness, burning, tinglings, we're going to probably think there's other macros and
Right.
micros that are more likely to be the deficient driver, but it, this is always a possibility,
Yeah.
right?
Yeah. Yeah. Absolutely.
Right.
And of course, with those, we'll say, um, less severe symptoms, then there's more severe deficiencies, which is beriberi disease.
Yeah, talk about that,
Yeah,
please.
there's four types, and we were discussing this like
Uh-huh.
getting back into our notebooks and and everything. But four different types: dry, wet, cerebral, and gastrointestinal.
Right.
So we'll touch on the main ones that may be more common out of these, the
Hmm.
dry and the wet.
Yes.
Um, Dry is more of a, I will say, like you discussed peripheral neuropathies, and that's what it is on a more severe level, where
Yeah,
the
basically severe. Yep.
yeah, and it's the like characteristic symptom is burning feet syndrome, and so we may notice like exaggerated reflexes, loss of sensation, muscle weakness, and then so that's dry, berry, and then we
Hmm.
have wet, where this is introducing more of the cardiovascular symptoms. So enlarged heart, rapid heartbeat, swelling, difficulty with breathing, and congestive heart failure.
Yeah. Scary stuff.
Yeah.
Yeah, yeah. And then is basically just out of curiosity, is like the cerebral beriberi, is that not fairly similar then to like Wernicke-Korsakoff
Right.
syndrome, basically,
Right.
right? Because as you were saying that, because a lot of the symptoms with the Wernicke-Korsakoff is severe confusion,
Hmm.
severe memory loss, like people like actually having like almost blindness with vision
Yeah.
problems, and if severe enough, like people could actually lose entirely like nerve and muscle function and become
Hmm.
paralyzed.
Yeah.
Um, all that's scary,
Yeah.
but we want to remind everybody in the
Right.
U.S. the thiamine is extremely rare that somebody gets to that level of deficiency.
Yeah.
But there are countries in the world that are developing countries that unfortunately this
Hmm.
conversation is very real,
Right,
right?
absolutely. And with the cerebral, where you mentioned Wernicke's encephalopathy and Korsakoff's psychosis,
Mhm.
um, it is most common too with alcohol consumption.
No question. Yeah.
So obviously, yeah, that. But yeah, all of those characteristics and Wernicke's can lead to Korsakoff's, and then they're together as like syndrome of them together.
Yeah, there we
Had
go.
to look back in my notes for
Yeah.
that one.
Well,
I
thank
was
you
like,
for
wait,
thank you for
yeah,
clarifying
yeah.
on
I was
that.
like,
I appreciate that.
yeah. Well, how did we differentiate that? But yeah, one can lead into the other, and then they're just combined into a
Yeah,
syndrome. So yeah.
absolutely. And then how about the gastrointestinal really
Yes.
briefly?
So that's with high lactate levels, which can lead to lactic acidosis. And like this is where it's difficult because it's like, okay, is it specifically, thiamine deficiency? Because the
Hmm.
symptoms are, I guess, a little bit more broad or generic. So it's the nausea, vomiting, and then abdominal pain.
Yeah, right.
So there's probably more to the story as far as like, again, like why are we getting that high lactate levels? What about absorption,
Hmm.
etc.
Exactly,
Yeah.
exactly. So, well, now that we highlighted the very serious and the very scary severe,
Hmm.
again, we're not trying to be dismissive, but we practice healthcare here in the United States, and
Hmm.
again, for moments or for reasons that we'll get to when we get to this how much bullet point, we're very rarely in this country seeing those really severe beriberi and the Wernicke's and the
Hmm.
Korsakoffs and the cerebral beriberi,
Right.
thankfully. So on that note, if we scared the pants off you a little bit and you're like, I'm gonna go hit like a bunch of like vitamin B1 like crazy because I don't
Yeah.
want that. Hopefully that's not what we did, but if
Yeah.
that is what it is, we at least have a little bit of good news. There is no discernible evidence anywhere in like the CDC or the NIH or anything that actually says that there's such thing as a thiamine toxicity.
Hmm.
Now, this will be a different conversation for months to come when we start talking about things like vitamin B2 with riboflavin,
Yeah.
and even when we talk about folic acid,
Yeah.
like there are potential concerns about overdoing like folic acid. But thiamine seems to be one of those very few where it's like there's not really evidence of like a toxicity problem.
Right.
With that said, though, you can still give yourself a really bad tummy ache if you
Yeah.
way overdo
Absolutely.
thiamine. So, like gastric distress, that is still a real thing. So, we're not gonna encourage you go and like give yourself like a mega dose of thiamine just to chase
Right.
this away. You're probably going to be taken care of more than well enough if you eat a pretty well balanced diet and you are responsible with your
Hmm.
alcoholic consumption,
Right.
basically,
Yep.
right?
Yep. Absolutely. Yeah. Well, then kind of on that topic, since, toxicity isn't a, too big of a fear, um, we'll talk about like how much we should get. And most likely you probably are getting it. And
Yeah.
again, we want to keep in mind like causes for deficiency. So with some of those conditions and alcohol consumption, but the recommended daily intake is one for adults. I'm picking on adults right now.
Yeah, sure.
Is 1 to 1.2 milligrams.
Yeah.
What does that look like? Um, Basically, well, for like cereal, basically like a half of a cup of like fortified cereal.
Yeah. A
So
day.
yeah.
Yeah. So
Yeah.
you're probably nailing it.
Yeah. Yeah. So yeah, that's about like that's the recommended daily intake.
Yeah,
I don't know
yeah.
if you want to elaborate on any of
I,
that,
I
but
do actually want to add a
yeah.
little bit more to the how much. I
Yeah.
agree. I saw like, I think the RDI, they'll recommend slightly higher for men. They'll say
Yeah.
1.2 for
Yep.
adult men, 1.1 for adult women. If you are expecting to be pregnant or thinking that you might
Oh
be
yeah.
pregnant, then maybe a slight bump up to like
Mhm.
1.4. But once again, you probably are getting ample enough. So you don't need all of a sudden be
Yeah.
like, I'm pregnant, I'm going to eat an extra bowl of cereal. You probably
Right.
are already fine
Yeah.
as far as that goes. As far as the children recommendation, again, correct me if I'm wrong here,
Yeah.
or internet, go ahead and roast me if I'm wrong. I don't think I've met a single child that isn't a little bit of a carb monster, right? Like they love spaghetti, they love
Yeah.
pasta. They, if you say like we're having cereal for breakfast, they get excited, right?
Yeah.
So
Me too.
again, children, they are probably fine, but usually the recommended amount is going to be under 1 milligram.
Mhm.
Like I think even for like kids under 5, it's
Yeah.
like 0.25, and then as you get into the teenage years, it's more like 0.5 to 0.75. But
Yeah.
once again, just to get the actual technical numbers out there, but most of us are doing just fine.
Yeah.
Now, again, not super common to have a deficiency concern in the US, but at least talking through what physicians would do if they're trying to work somebody out of some sort of deficiency is if they felt that it was more of a mild deficiency, then they might help you get like an oral a dosing of like 5 to 30
Yep.
milligrams a day until the symptoms clear out. And then if we're talking about like one of those severe dry berry, wet berries, if it's like again in like a developing type country, then they could do a severe load as high as like 300 milligrams
Right.
a day. Again, the vast majority of us,
Yeah.
we don't need that. That
Yeah.
that would probably give us a heck of a stomach ache, and it wouldn't be worth it, right?
Yeah.
So, but just getting that data out there for
Yep.
everybody to have and know and learn, right?
Right. Yeah, absolutely. And that's now I with talking about how much and where to get it, and if do you how do you know if you're deficient? One, again, probably unlikely. There's
Mhm.
probably other things that we want to prioritize if you're experiencing some of these like lesser symptoms. But a question that I've been asked before is like, well, how do I test this?
Yeah,
You
great.
can do a blood and urine test for thiamine. It's actually not that reliable. I
Oh, really?
typically,
Okay.
yeah, I when you're testing, you can test TPP, which is thiamine pyros. Oh wow, I'm gonna butcher this. Pyrophosphate.
Okay.
We'll put that in the notes. But
Sure.
anyways, that is a little bit more reliable. But also you can do like organic acids, which is a urine test, and you can see more of like coenzyme
Mhm.
factors that are going into that, which it is an indirect way, but it's more reliable than blood and urine. Just
Gotcha.
putting that out there too.
No, glad that you shared that too. So
Yeah.
tying back into the how much, I know you mentioned that that half cup bowl of cereal, basically getting you to your RDI for
Mm-hmm.
that. Other great foods to add onto the list. Of the meats, it seems like pork is, for
Yeah.
whatever reason, pork is
Yeah.
like the best on thiamine. I'm sure there's some scientist out there that knows and will tell me in the comments why, but that's pretty good. The fish is great too,
Mm-hmm.
and also just encouraging fish. It's a different conversation for a different
Right.
day, but for like our fatty omega-3 acid,
Yeah.
well, fish is
Yeah.
fantastic to have. So if you want another reason why you should be eating fish, throw thiamine onto the pile.
That's right.
Many breads, we already talked about like the cereals being fortified. Brown rice and whole wheat breads are fantastic for this
Yep.
too. Plus, like we kind of like to encourage people to eat more like the whole grain, the multi-grain, and more
Yep.
like the brown rices anyway. The stuff that's less processed because it's
Mm-hmm.
just better for you and better absorbed and better for like your glycemic indexes, for
Yep.
example.
Yep.
In the vegetable world, asparagus, Brussels sprouts, seaweeds, those
Yeah.
seem to be ones that are really high in our thiamine. And then going into kind of like the other, again, just tailoring things a little bit for vegan and vegetarian, right? Black beans, lentils, sunflower seeds,
Yep.
those are not by all means everybody and everything, but those are some of like the high ranking
Mm-hmm.
guys that carry thiamine, right?
Yeah.
Anything you'd care to add to that?
No, that is those are the main ones. I know last time I talked about nutritional yeast. I don't know why I got on such a tangent with that, but it is also super high
There we
in
go.
thiamine.
All
So
right.
I was like, I'll pull that one out. So yeah, another one.
Nutritional yeast, 2 out of 3 topics. There you
Yeah,
go. Boom.
yeah. But no, I think that those are the main sources and
Yeah.
solutions on how to get it.
Yeah. And so I guess that kind of like ties in, but if you want to go first, I know
Yeah.
obviously probably thiamine as far as our solutions, this is going to be taken care of pretty well for diet.
Yeah.
But are there any kind of like specific kind of dietary recommendations you like to make in your office on the functional medicine side of things to kind of shine the spotlight on this then?
Yeah, I mean, would want to dive into their overall carb tolerance.
There you go. Yeah.
Um, and so we're talking about thiamine, but it's really hard to just pinpoint this one. I would want to dive in on their vitamin K status and folate to see again more so on that aspect. Like, okay, are we getting enough complex carbs in the system? What are we as far as their daily intake, what might be missing?
Mm-hmm.
That's how I would approach it. And of course, I see a lot of women that may have been on or are currently on birth control medications or the
Yeah.
pill hormonal birth control, and that does deplete a lot of B vitamins. So of course then we're gonna be, again, broad with our B vitamins and make sure that we're getting it from food or, if needed, a supplement. The most common forms on a supplement that you'll see are thiamine monotitrate and then thiamine hydrochloride. And
Okay.
those are fine forms.
Awesome.
Yeah.
Awesome. Yeah. So I think what you're kind of elaborating on is, if I make sure I hear this
Yeah.
correctly, is that this is probably not one that you're going to specifically isolate and practice and say, like, let's talk about
Yeah.
thiamine. But if you have like an inquisitive enough a patient and they like to kind of understand how things are tying in, it
Yeah.
does at least open up the door to say, like, listen, you're probably already taking care of this when you are addressing other things. But if you do want to know how important thiamine is, like,
Yeah.
hey, come watch this
Listen in.
podcast and you
Yeah.
can see how it's actually going to tie into like your importance on vitamin K and whatnot,
Yeah.
right?
Yep. Yep.
Okay, awesome.
Absolutely.
Awesome. The only thing I want to add on our solutions, and it's the same thing I kind of add at
Yeah.
the end of all of our podcasts, is once again, if you go over to Dr. Maggie and she takes care of your gut health and she's doing a fantastic job getting kind of all your functional medicine needs addressed, and there's still some of those less severe potential thiamine symptoms, again, the numbness, tingling, burning, weakness in the hands. Again, I kind of said this earlier in the podcast,
Right.
but if you hear hoof prints, you're thinking horses, not zebras. So that's probably going to be like a nerve involvement. A lot of
Mm-hmm.
times it's like a pinched nerve, potentially from something like a cervical disc or even a lumbar disc that could turn on numbness in the feet.
Yeah. Yep.
We are both really good at that. My big focus in our practice is with McKenzie
Yeah.
method physical therapy or rehab, and that is going to therefore give you the exact right tools to make sure that you are rehabbing that disc and that nerve to get yourself better. I know you mentioned um, some supplementations as well too.
Mm-hmm.
At this practice, we're in the infancy phase of starting to recommend a little bit of like the whole food supplements. Particularly, we like our standard process line,
Mm-hmm.
and just as a general tie-in with the standard process stuff, a couple of like their multivit or basically their multi complex that are
Mm-hmm.
just kind of for general health are really going to take care of the B complexes. So if you're on the Cataplex B, for example,
Okay. Yeah.
you're not going to be anywhere close to deficiency. And then their Catalin product is also really good for taking care of a lot of the B problems.
Yeah.
So I think that's about all I could kind of tie in. I think we talked this issue pretty well through.
Yeah,
What do you think?
I think so too. And I'll just emphasize that if someone was experiencing, again, the most common thing that as chiropractors we'll see is that numbness, tingling, those neurological symptoms. It can be synergistic too, the care, as far as like working with a chiropractor, getting that manual therapy, that rehab, or a PT, whoever your provider may be.
Mm-hmm.
But also you can still take that time to dive into your nutrition or what may be going on as far as absorption and excretion.
Exactly.
So yeah, it's all about treating the whole person.
And that's honestly just to take a step back from the 30,000 foot view. That's why we asked you if you were interested in doing podcasts in the first
Right.
place.
Yeah.
It's because that's the bigger vision that we're trying
Yeah.
to educate people on. Is you don't necessarily need to think of like, I'm going to these doctors and I'm working in a silo where it's like,
Right.
this is my chiropractor, this is my dentist, this is my general doctor, this is my cardiologist that I talk to. The reality is if you're willing to open up and just kind of like have a little bit of an honest discussion with those docs,
Yeah.
that you'll start to really see very quickly how like all of us actually really are webbed and tied in together. And we all, I believe, have the best intentions and we want our patients to get better. And
Yeah.
just trying to be synergistic and collaborative, I think, is when we get people from being just, not just illness free, but
Right.
truly getting to wellness.
Yeah. Love it.
There you go. I'll step
Yeah.
off my soapbox
Yeah.
now and wrap up this.
Yeah.
From our macros and micros podcast, want to thank Dr. Maggie Sopic
Thank
again.
you.
Plug yourself for a second if you don't mind.
Yeah, so I'm Dr. Maggie Sopic. Like I said, I own Recenter Chiropractic Wellness and Functional Medicine. I'm in Boalsburg, so I'm a chiropractor and functional medicine provider. So for all those needs, you're welcome to come here. But Dr. Emery, you plug away.
Sure. Dr. Emery Pitcel, Rothrock Chiropractic and Rehabilitation, 3 miles up the road from you. 2, 3, something like that. We're on South Atherton, right next to Ramada Hotel. And we, again, kind of like very rehab focused, very chiropractic focused, but we love being able to have some of the conversations about proper supplementation and proper functional medicine management. Um, yeah, and then otherwise, you can see our contact information in the descriptions
Yep.
below. But we appreciate everybody for tuning
Yeah.
in for our third episode in April of 2025 here.
Yeah.
We hope you found it valuable, and if you did, just leave us a little comment and
Yeah.
say if you liked it, or something that we maybe said that was incorrect. We welcome constructive criticism.
Right.
We don't shy away from it.
All about that dialogue.
Absolutely. So, but subscribe to the channel if you found this helpful, right?
Yeah.
All right.
All right.
Well, we will be back next month.
Yeah.
Topic to be determined. But for the meantime, we appreciate you all for watching.
Yeah. Thank
And
you.
yeah, take care until next month, everybody.
See ya.